This is the history taking for the CS examination. As I said, do not expect to teach you the fundamentals. We are going just to teach you how to apply what you have already. I'm going to give you just a plan, a roadmap for the CS examination. So we divided the history into two main categories: history, present illness, and past medical history. And as you notice here, I intended to write this one is big because this one is more important than the past medical history. And under the history, present illness, we are going to analyze two, review two. Analyze the chief complaint, which is in the doorway information, whatever it's headache, joint pain, vomiting of blood, diarrhea. Okay, and we're going to analyze differential diagnosis and then review of the local system and review of system or other system. Let's explain those in detail. Okay, we're going first. Why I subclassified those? History present illness, as you see, it's a dynamic one. What does it mean? It changes with each case. So if it's headache, it is different history present illness than it is abdominal pain. It's different than joint pain. But past medical history, it is easy because it's a set of questions. You're going to keep them. You are going to ask all of this question in all patients, so it is easy. This one is important. Why? Because you will rely on this part to bring the differential diagnosis. This part is also important, but we make it important. We did it important really because we're going to teach you also to maximize your performance in the past medical history. For that reason, we strongly advise to give the past medical history 5 minutes and give this one not more than 2 minutes. Okay, this is my advice. Let's start with history of present illness. Okay, history of present illness. History of present illness. Okay, as I said, this one is important. We are going to rely on this part for the patient note for the differential diagnosis. We start with the chief complaint, or what I said before, analyze. Just as I said, we are going to analyze chief complaint, differential diagnosis. We are going to review the local system, and we are going to view the review of system. This is the best plan. If you follow this routine, in practicing for like 20 or 25 cases, you are going to make a routine. So it will be in the subconscious level. So what I'm practicing right now, I practice something which I do not care because I have I have practiced this way, and right now it's in subconscious level. And trust me, the idea here at the end, before the one day before the examination, we are going to review only the differential diagnosis only. So we are going to review the whole syllabus of the CS in a couple of minutes. Before the examination, we are going to review only the differential diagnosis of each case because the other components are maybe fixed. Okay, already fixed. Okay, let's start with the complaints. There are many complaints in this examination, and people, please trust me, it's not only liquor, it's not only pain, because half of the cases in the examination are not pain. So people said, okay, liquor, everything liquor. Okay, liquor is nice, but liquor is nice, but okay, this is nice for pain, but it's not nice for all patients. How do you analyze fever and cough and vomiting, diarrhea, bleeding, depression with the liquor? How do you analyze domestic violence, sleeping disorder, nocturnal enuresis, forgetfulness, dizziness, palpitation, hot flashes, all of this stuff with liquor? So liquor is nice, but liquor is for pain, and you should know the other analysis. Okay, so regarding pain is the most frequent complaint ever in this examination. I have two ways to analyze pain. Okay, so you can choose whatever you prefer. Okay, so this is the first way I usually prefer it. Onset, course, duration. Okay, and then site and radiation or reference, radiation. And then I CSF, which is C for quality, C is character, severity, and frequency. And what increases, what decreases. And then association. Here is location, intensity, quality, okay, quality, onset, radiation. Okay, onset. When did it start? Did it come on suddenly? Since it started, has it getting worse? Where is your pain? Do you feel the pain anywhere else? Could you describe the pain for me? On a scale of 1 to 10, 10 is the worst pain. How bad is your pain? Is it constant or does it come and go? Does anything make it worse? Does anything make it better? What symptoms do you have besides pain, or do you have any other symptoms besides pain? This is the analysis of the pain. Okay, pain, because pain is so often, so frequent complaint. This is examination. You should memorize all of these questions, in the subconscious level, because it's so frequent. The second frequent complaint in the CS is fever. So this is the way you are going to analyze fever. How long have you had fever? Did you check your temperature at home? What was your temperature when you check it at home? Did you take any medication for the fever? Has the fever come down with like Tylenol? This is for analysis of fever. How long have you had fever? Did you check your temperature at home? What was your temperature when you check it at home? Did you take any medication for the fever? Has the fever come down with, say, the medication, say like Tylenol? Okay, has the fever came down with Tylenol? This is for fever. Okay, cough. How long have you been coughing? Okay, is it worse in the daytime or at night? Does anything make your cough better? Does anything make your cough worse? Do you cough up any mucus? And if this is a mucus, A, B, C, D. For any secretion that comes out of the body, you are going to deal with it like A, B, C, D. Okay? A, B, C, D. Amount. A for amount. B for any blood. And C for the color. And D for odor, if you have. So I have mucus. Okay? I have mucus. So ask, how much mucus do you cough up? How much mucus do you cough up? Okay? How much mucus do you cough up? Did you see any blood? What's the color of the mucus? This is for mucus. How much mucus did you cough up? Blood? Did you see any blood? And the color, what's the color of the mucus? No need, I think, to ask for odor. Okay? Vomiting. I'm going to use this ABC right now. Vomiting. Okay. Have you been coughing? Have you been vomiting? Have you been vomiting? Do you have vomiting? Are you able to keep things down? Okay. And then amount. How much or how many times did you vomit? How much did you vomit? Is it a teaspoon, tablespoon, or half cup? Blood. Did you see any blood in your vomit? Color. What's the color of the vomit? This is for vomiting. Going to diarrhea. The same. Amount, which is frequency. How many times did you have diarrhea? Do you have diarrhea every time you go to the bathroom? Did you see any blood? What the color of the diarrhea? Okay, this is for diarrhea. So anything that comes out or any secretion, you can use A, B, C, D. Okay? Bleeding disorder. Any bleeding disorder. This is a good mnemonics. 4. Vomiting of blood, which is hematemesis. or hemoptysis, coughing, or bleeding per rectum, or vaginal bleeding, or hematuria, all of them we can use. So for bleeding disorder, we can use A, B, C, D, E. E also for amount, okay? Amount. B for blood thinner mitts. C for the color and for clots. D for dizziness. E elsewhere. Okay. How much blood? Okay. Or how much did you bleed? How much did you bleed? Could you estimate the amount of the blood, please? Is it a teaspoon or tablespoon or half cup? Did you use any blood thinner mitts? Color. What's the color of the blood? Was it bright red or dark red? Did you see any clots? Do you feel dizzy? Do you have bleeding anywhere else? We use blood thinner medication and elsewhere else. So we ask about those because they indicate for generalized causes. So if the patient has Marivan, okay, as a blood thinner, or heparin, he probably has bleeding from more than sources. So what does it mean? It means that it is a systemic effect. It's a systemic cause. If the patient has blood disease, or coagulation problems, he may bleed from other many orifices. So we use blood thinner mitts and bleeding elsewhere to determine a generalized cause of bleeding rather than local. And we ask about dizziness to just for as a rough estimate of the amount of the bleeding. If the patient bled too much blood, he may have dizziness because of hypotension. Okay. This is the analysis of the bleeding disorder. For depression, okay, just if you feel that, if you notice the patient with a osteoarthritis patient has sadness or feel depressed, ask just a few questions. Depression. Do you feel sad? Do you feel depressed? Have you ever felt like life isn't worth living? That's enough. If the patient says yes, I'm sad, I'm depressed, I felt like life isn't worth living, you are going to proceed for SIG E caps, or going to deal with them in the psychiatry. Okay, which are sleep and interest, guilty, energy, and others. Okay, so just for depression, okay, you can ask those. Okay. Infectious diseases. Infectious diseases. Like what? Like upper respiratory tract infection, common cold, tuberculosis, hepatitis, meningitis. You can ask, have you been around anybody sick? Have you been around any sick person? So what about your immunizations? What about your shots? Are you up to date with them? That is a general questions for infectious diseases. Complaints that come in episodes, like what? Like panic attack, palpitation, transient ischemic attacks, bronchial asthma, dizziness, hot flashes, all of those we collected them together. So those complaints come and go. So you can ask, how often do you have racing heart? How often do you have, or do you get dizzy? When was the last time? How long does it last? Do you have any other symptoms besides hot flashes? So how often do you have? When was the last time? How long does it last? Do you have any other symptoms besides this complaint? This is for complaints that come in episodes. plus open-ended questions. You can use the following questions if you know, as emergency plan. You know, I love emergency plan. So 2 questions. Do you have any idea what might have caused that? So just open questions. Yes, the patient says, going to say, yeah, it probably due to something. Okay. So do you have any idea what might have caused that? Do you have any other symptoms besides pain? So if you can't find anything, you can ask the patient, do you have any other symptoms besides something? Okay. This is for the analysis of the chief complaint. I'm going to demonstrate for you a real cases. We are going to show to you how we are going to analyze some of the complaints. Okay. Could you tell me a little bit more about your pain?
It's my lower back.
Your lower back?
Yeah.
Okay. When did it start?
Just a few hours ago.
Few hours. Did it come on suddenly?
Yeah, very suddenly.
Since it started, has it getting worse?
Yes.
Okay.
Yeah.
So where is your pain?
In my lower back.
Lower back?
Yeah.
Okay. Do you feel the pain anywhere else?
Yeah, also my left leg.
Your left leg?
My left leg sort of.
You can be comfortable if you want.
Well, it hurts when I move.
Okay. You are comfortable right now?
At the moment, yeah.
Okay. So moving to the left leg. Left leg. Okay. So could you describe your pain?
How can I describe it? It's like an electric shock.
Electric shock.
Pain.
Electric shock. Okay. So is it constant or does it come and go?
It's quite constant.
Constant. Okay. On a scale of 1 to 10 is the worst pain. How bad is your pain?
On a scale of 1 to 10, I maybe 4. But when this sort of shock pain comes, it's double that.
Okay. So does anything make it worse?
Moving, yeah.
Anything make it better?
I've been taking painkillers. And that's helped.
Okay.
But if you can give me anything else, any other painkillers,
I understand.
I appreciate it.
I understand your
concern.
concern.
A bit stronger.
You're okay. I understand your concern, but giving you any pain medicine right now may change the quality of the pain, and it's hard for me to diagnose it.
Okay.
Once I have a final diagnosis, I'm going to prescribe the meds.
Okay.
Right?
Yeah, that's fine.
Okay. Thank you so much. We are here to help you. Okay. What were you doing when the pain came?
Well, unfortunately, I was at work and I lifted a heavy box.
Heavy box.
I guess that's what caused it.
Okay, heavy box. Okay. Do you have any other symptoms besides pain?
No.
Okay.
No.
So, how long has she have a fever?
Since yesterday.
Since yesterday. Okay. Did you check her temperature at home?
Yeah.
Okay. What was her temperature when you checked at home?
101 degrees Fahrenheit.
101 degree. Okay. So did you give her any medication for the fever?
Yeah, Tylenol.
Tylenol. Has the fever come down with the Tylenol?
It's only by half degree.
Okay. When the fever comes, does she have any sweating?
No.
Any chills?
No.
Is she alert or sleepy?
She is sleepy and weak.
Sleepy. Okay. Does she shake as if having seizures?
No.
Okay. Does she have any symptoms other than fever?
Yes, she also has cough.
Cough.
Well, I've been having some hot flashes.
Okay.
Yeah.
Hot flashes. Okay. So how long have you had this problem?
6 months, around that.
6 months. Did it come on suddenly?
Didn't really notice, but yeah.
Okay. It's gradual, I mean?
Kind of.
Gradual. Okay. And since it started, has it gotten worse?
Not that much worse, but kind of like the same.
The same.
Yeah.
Okay. So how often do you have flashes?
Well, it depends, but I have it 4 to 5 times a day.
4 to 5 times. Okay.
Yeah.
So how long does it last usually?
About 3 minutes, 2-3 minutes.
Okay, 2 to 3 minutes. There is any warning beforehand?
No, not really. It just
No warning. Okay. So from the nurse note that you have vomiting. Could you tell me a little bit more?
Yeah, I vomited in the last 6 hours.
How many times did you vomit?
3 times.
3 times. Did you see any blood in it?
No, nothing.
What the color of the vomit?
Whitish.
Whitish. Okay. Also, I saw that you have diarrhea. Okay. So how many times did you have diarrhea?
2 times.
2 times. Did you see any blood?
Nothing.
Okay.